In this video, we will be seeing about usability testing. In this course, testing and calibration, it is mandatory for us to know about the testing process. And one such testing is usability testing. Usability testing provides a lot of information regarding how an equipment works, and the results of an usability testing can provide very important information on how to improve the design of the medical equipment, its working capabilities, and much more. So let's understand what usability testing is. So before getting into that, in this particular video, we'll be learning about usability testing and what are the terminologies involved that will help us in understanding this better. That is the use error, close call, and difficulty. And then the requirements that are necessary to conduct a usability testing in a medical device. And then we'll also learn, is it mandatory to conduct a usability testing for even a small minor design changes. And then finally we will see whether usability testing and market research the same, or what is the thing that differentiate one from another. To start with usability testing. Usability testing calls for representative users to perform representative tasks as a means to reveal the interactive strengths and opportunities for improvement of a device. So you can see from the image that there are people near hospital environment, inside a hospital environment, and there are few people sitting little away. That is, there is a partition between these two set of people, and the ones who are inside the partition, the transparent case, are performing the usability testing, and the people who are sitting outside, they are also performing usability testing, but they are observing, they are the observers. They see how the users, that is the representative users, are performing the representative tasks that are assigned to them, and from that they can understand how a medical device is used without any issues, or if there are any issues, they take a note of it and they give it as an input to the manufacturers so that they can strengthen the design of the equipment. So what kind of questions that are asked or that can be kept in the mind while performing or while observing the test, or like the task completion rate, how fast, or like how users can, how many tasks the users can complete successfully. Then second one is time and task, whether the people who are performing this task are able to complete the task on time. For example, if you take an AED, um, automatic external defibrillator, its purpose is to provide a defibrillation during a critical time. At that time, the person who is handling the medical equipment, that is the AED, they should be able to do it in a particular time. So this usability testing will provide the users, I mean the manufacturers, to check whether the users are able to complete the task on time. So if while conducting the usability testing, if the person who is doing the task, if they complete on time, then it will provide them a satisfied takeaway. If not, they will look into the aspects where they are struggling and how to improve that. And then error rate, how many mistakes they make before completing the test. Then navigation issues, where the navigations are proper in the screen, where the user interface is proper. The user confusion points, where do the users usually get stuck or hesitate to perform or proceed further. Then the buttons and link clarity, or the buttons are interactive enough to help them understand what they are intended to do. For example, using the red color buttons, the green color buttons, all those things are to be properly checked. Then the user satisfaction, whether the user finds the experience enjoyable and efficient. Is there any comfort, I mean uncomfort situation that they see. Then redundant steps, or the users taking unnecessary actions to complete the task. This is also very important because they might be doing the same step again and again, and this will create a waste of time. Then accessibility, is the design usable for people with different abilities, that we have to see. This is where the interactive elements once again comes into the play. Then this is where you can have like on-screen instructions or voice notifications or some kind of a graphical interactions, as that will help the people with different abilities to perform the operation. Then first time user experience, do users understand how to use it without guidance? That also plays a very important role, especially if the medical device that is manufactured and it is intended to be used in a home environment. Then the overall feedback, So all these are the things that are to be kept in the mind. And then when it comes to medical device, they have three classes. There are different classes in different versions. But then here we have general controls, special controls, and pre-market approvals. So based on this, the usability testing differs. For general controls like gloves, medical gloves, the usability testing is not very stringent, whereas in special controls it is stringent, and in pre-market approval it is very strict, and a lot of things to be considered before proceeding further. Now let's understand what the terminologies, the use error, and a few more things. Use error, to start with, is a jargon term that usability specialists use to describe cases in which usability test participants make a mistake. So it's not a very huge mistake, but then it's a mistake. These are use error. For example, if the button is not pressed properly, that's a use error. In medical equipment which needs electrically conductive gel to be applied, if it is not applied, that is a use error. Tablets, if two tablets look similar, if they are of both same color, but the user doesn't understand the difference, then that makes a mistake. So here are a few cases, like a layperson inhales once instead of twice when administering a single dose with an inhaler. That is a mistake. Then a surgeon implants a drug put upside down, preventing the needle access to the septum. Another mistake. Then critical care nurse uses an incompatible disposable tubing to set for blood infusion. Again, it's a huge mistake. Then a resident physician connects a pressurized oxygen line to an IV access instead of an IV fluid line. Again, it's a wrong wiring. It's a mistake. It's a mistake made by the user. That again is a user error. Pharmacist selecting wrong epinephrine pen with an incorrect drug volume. Mistake. Hospital housekeeper accidentally adjusts the hospital bed position while cleaning. While they bend down unintentionally, if they keep your hand on one of the lever, it could change the position of the bed. That could create some discomfort to the patient. Then biomedical technician enters the wrong calibration value in a dialysis machine setup screen. See, all these are all the mistakes. But if you look properly, if you look with an engineer's perspective, you can understand that this can be brought down by proper design. Right. So these are all the use errors classifications. So one is unintended, the other one is intended. Intended in sense, it could be because of a slip, lapse, or mistake that causes additional failure, memory failure, rule-based error, knowledge-based error, and negligent error. Whereas in intended mistakes are there, and intended instead of a correct use, if we don't use it correctly, it causes abnormal use, which will produce unwanted error. Right. So this use error, it could be based on perception or cognition or action. So we have like three examples here. A nurse misreads a medication label due to poor lighting. So if you see most of the ICUs, to ease the patient, it will have a different kind of a lighting, and it will be generally dark. Right. In that case, if the nurse, if she or he wants to connect a tubing, and if the light is not proper and they connect the tube improperly, then that is a use error by perception. Next, a physician assumes a syringe is pre-filled with saline medication, saline, and if they administer it to the patient, it is an error, cognition error. Then action error is like the one we discussed earlier. The housekeeper unintentionally presses a hospital bed control button while cleaning, changing its position. Right. So these are all the use errors. And then now we will see about close call. What is a close call? During a usability test, participants sometimes come close to make a mistake, or they make a mistake but correct it before any harm could occur. This we call it as close call. Something wrong, something something that is not supposed to happen is about to happen, but it is prevented. So that we call it as a close call. For example, here a nurse almost administers the wrong medication but notices the label mismatch just in time. So this is a very important thing that we have to understand. That is, this is also the reason why most of the medications have different colors. Right. So this will help the people, the users, to avoid the last minute error or the close calls. Right. Then surgeon preparing to operate on the wrong limb but catches the mistake during the surgical timeout. This is a serious close call. Right. Similarly, a pharmacist nearly dispenses a high dose insulin pen instead of a low dose version but double checks the prescription. very important thing. Anesthesia sets the ventilator to an incurrent oxygen flow, but current sits before intubation. So these are all few close calls. Finally comes a difficulty. So difficulty is any hindrance that a user experiences before completing the task. So this does not mean the task is incomplete. The task will be completed, but then there will be a small difficulty, a hindrance that have caused them to stop the task and proceed further. Right? So for example, a nurse takes more time than expected to open a kit. For example, if there is a fresh kit, usually in a hospital environment after autoclaving, or there are situations where new kits are used for every surgery or surgical procedure. So at that time, they have to open the case. While opening the case, if the case is packed only for aesthetical, I mean only considering the aesthetical appearance, and if it is not considering the usability, the nurse will find it difficult to open the tray or open the kit. It will create unwanted time. But then after a few time, after pulling the different tabs and tapes, then lifting the medical devices or the apparatus required, so this will create some difficulty. So that is what we talk about, the difficulty. So a simple packaging would be much more meaningful rather than aesthetically appealing, right? So this, all this taking into consider, they have set a common regulator commands. Regulator encourage medical device manufacturers to conduct usability test, and therefore with this they prefer test plans, or what are the things to be done. The focus on the riskiest hands-on tasks. So this will help them in identifying what are the possible risks that could come out of it and how to manage. And from a regulatory perspective, the ideal test plan will raise confidence that the ensuing usability test will reveal user interface design flaws that could lead to dangerous user error if there are any. So by doing that, they can understand or they can find out if there are any possible dangerous use errors. Right? We have few more other topics which we will continue in the videos to come. Thank you.